in the VBAC group, so there are people that respond that have no intention of giving medical advice, that don't even realize they're doing it. So a lot of lay people, which would be like my friend coming into the group and be like, when somebody asks like, how long should I stay home, or I haven't felt, let's use the baby, I haven't felt my baby kick in a while. What should I do? And we've talked about this before. You should always go to the hospital. But somebody comes on and says, hey, I stayed home. My doctor told me to drink a cold soda, or go lay down. And it's just like, and we have to acknowledge that reply. And some people feel called out, but we have to be like, no, this isn't safe advice. Sometimes we delete that response altogether and reply and be like, hey, there was unsafe medical advice being given. But we can keep it up to point out to people, because that's how people learn anyways, and be like, look, this was unsafe advice because X, Y, and Z can happen. And the only advice that you can say in this situation is go in and get checked out. So there are like a lot of lay people coming on, and that's something hard that we do, particularly in the VBAC group, is stop these, medical advice and just their own experiences too. That's not the same for everybody. And just because you drank a cold soda, like your doctor said, which is outdated advice, and everything was okay, it may not be for that person. And she may have been listening to you instead of people saying, oh, well, you should go in. And because she had warm, fuzzy feelings from this poster, oh, she was okay, she drank a cold soda, felt baby moving, which we know that isn't always an indicator that everything is okay. We still know that things can still be off and to go in. So the medical advice in these groups, it's a hard line we draw in our evidence-based group, and people don't like it. Some people do acknowledge it and been like, whoa, I didn't know. And we kind of be like, well, look, for future in other birth groups. And I talk about birth groups. These also can be your birth due date months, year groups, because we've always been in part of those. And I know when I was pregnant with my last, and I'm like, I'm not joining any group. I joined a group and then just was like ticked off. And I'm like, all this unsafe advice all the time. So I'm like, I'm going to make my own. And, people didn't want to join it. People left because it wasn't the warm, fuzzy feelings that you kind of hear. And, yeah, we can talk about what we made for dinner, what we're all craving, but no, you can't talk about, the medical advice or telling people that, oh, what you're feeling's fine. You're dizzy. You're okay. You're okay. We can't allow that. And we hope that other people are picking that up in these groups and taking it into their other groups. And sometimes it's not received well in these other groups, but I think there's a slow change, and we've kind of been seeing that. But until these natural childbirth minded people like doulas and stuff start, they're just all over the internet, and it's scary. It is scary. And I think we've all seen the dangers and the advice that they give.
Yeah. And those due date groups, man, with your kids, they have the stuff going on with your kids. They'll show pictures of like rashes. They'll show stuff like whatever. And everybody's like, rub this on there and do this and they all have these like magical. And then I'm the person on like every single one of these posts, like, call the pediatrician. Just call your pediatrician right now. Your kid is swelling, like all this stuff's happening. Like, call your pediatrician. If they don't answer, take them to, like, we have quick cares is what ours is called here. Take them to a little urgent care, take them to someplace. If something's happening and it's like just physically getting worse, like of whatever, where you see your kids, whatever, just don't ask questions. Don't get online. Just go, please just go in, see somebody. They'll get you to where you got to go to get help. Like, your kid needs help. And I just cannot tell you how often I see that in due date groups all the time, of like pictures of like kids rashes, pictures of like
rashes,
kids needing like stitches. I actually have seen that where like there's like gashes where like, you think I can just butterfly clip this? No, take your kid in and just get some stitches. Like, it's huge. Like, your kid needs, like, don't get out a needle and start to sew it. Just take your kid in. Like there's just so many things like that where I'm like, please just take your kid in. And I've had friends that have like texted me, and and some people, I get it, like being a newbie mom or like, a newbie parent, like just parenting is scary. Like, but it's like, if you're new and you've never experienced it, you do like this thing of like, has anybody ever experienced this? But if there's things going on where you're like, they probably need some kind of physical care or some type of care, just take them in. And if you don't want to take them in because of whatever, just at least make a phone call. At least call a nurse line and see what they tell you to do. Don't take random information online because you don't know what is good and what is not good and which, and like that kind of thing always has drove me nuts of like, no, don't rub all that random weird stuff on an open wound or a rash or your kid's swollen of this. Don't do any of that. Please call your pediatrician. Please call your doctor, call a nurse line, or just take them in. Like, just if we have to do ABC, like just please, those are the things that I cannot, I see it all the time actually, especially in those due date groups, more than any other group is those due date groups of like, and I will say every so often now, because every time I see it, I always am the one just being like, call your doctor, go to the hospital, call your doctor, go in, call your doctor. Now I am starting to see people putting their thing up and they're like, I'm waiting for the pediatrician to call me back. I called them and they're asking the doctor and I'm on hold, but I'm just in a panic because anybody experienced it. And then I'm like, yes, I kind of feel like me being like, call your doctor, please go in, please go in.
It does. If people are exposed to it, the more you're exposed to it, the more you internalize it. So, yeah. So, when this VBAC group started, it was, I could actually watch the process unfold. And it was basically you be consistent, you reinforce what you want to see, you correct people when they do something that you don't want to see, and then enough people pick it up, internalize it, that the people who were doing the heavy lifting in the beginning can step back, other people will pick it up, carry on, and then it becomes the accepted culture. And then hopefully it spreads beyond the borders of the VBAC group. One hopes. But yeah, I think one of my favorite kind of posts is someone comes in and says, my doctor said I was the most prepared patient they ever had. And I'm like, yes, this is what I want to see happen. I want to see people go to their doctors and talk to them. That's all I really want to happen. And I want them to be able to do it in a way that works. And then they can get that positive feedback from their doctor. And I'm like, yes, we are doing good work. It's happening. It may not happen for everyone, but it's happening for some people.
Yeah, we just had a poster in the group talking about, and it was about the kick counts. Like they got outdated advice from their doctor. And some people get upset in these groups when we don't just, come out and say like, and answer directly. We ask questions to get like kind of the whole story. And the post was something about, well, I've been concerned about baby's movements and my doctor has said that to lay on my side or drink a cold drink. And some people are like, obviously the correct answer is like, no, you need to go in. And then, and sometimes the more experienced people, and I think I got on and was like, well, hey, did you call or did you go was this at the office? Did you go into labor and delivery? And then you found out, no, she was calling or she had even went into the OB's office. And it's like, no, you just go, bypass all that and go into labor and delivery. So when people, we do ask a lot of questions and it might be annoying to some people, but we're trying to get like, the general, like all of the information in there because some people are like, no, you've got to call or that was unsafe advice. And we're like, hey, you go into labor and delivery. They are trained. They're not going to send you home. You don't have to talk to your doctor or the nurse. Most likely it's usually the nurse or whoever's answering the call. Like, no, this is our protocol. And we can let them know like, no, that's outdated advice. But to kind of learn that she was calling her OB instead of just going in. And we're like, no, you need to go in. So there are questions that we ask, and sometimes we're called out because they think that we're giving medical advice. When the advice is, or we're asking these questions, not to get your whole medical history, because it's none of our business, number one, but it's how to appropriately kind of like guide you to help ask your doctor questions. If it's not an emergency, like they're just kind of going over their birth story or their upcoming birth as well. We ask questions and kind of help them frame those questions to their provider, their doctors. Like Andrew was saying, we just want open communications for the patients to the providers as well. And hopefully we can, kind of get that across a little bit better.
I like what you said because of that, because it makes sense of, you kind of have to know. And my doctor, when I was having my rainbow, when I was told about Count the Kicks, when we reached that point, they gave me a paper and they said there's an app and they were talking about it. I lived a couple hours away from the hospital, from the doctor's office and all that. So they actually told me, if any of this starts happening where you just notice baby's not really moving, like there's just something that's just off, they were like, you can call us on the way if you want to, but they were like, the reality is you don't even have to call us. Just go to the hospital. You know where your hospital is. Just go straight in labor delivery. They already have all your stuff there because this is where you're going to give birth and everything. So they know who you are, everything, whatever. They were like, just, you can call us to notify, but other than that, just go in. That was their big thing, because they were like, if you come here, we're just going to send you anyways, because we can do a little bit, but we'd prefer you to go there because they're going to do extra checks to make sure, because my doctor was very honest, like our equipment here can only do so much, but their equipment there sees more stuff, that there could be something else that I would miss and I'd feel better that you just went there. And that was my doctor. That was like, just any of this stuff happens, they basically kind of gave me like a checklist of everything, of all your reasons of why to go to the hospital. And they're like, even if you're kind of like, I don't know, they're like, you're not bothering us, you're not anything, just go straight to labor and delivery. Just there it is. And I think actually this is kind of funny, but I'm pretty sure they gave me a hospital map, because a lot of hospitals are really big. I think they gave me a hospital map. Park at this parking garage, go in this door, go up this ramp. Like they actually gave me a map, and they were like, just in case you ever have to use it. And then later at the end, I did end up going to labor delivery a couple of times if we weren't sure. And so I ended up using the map anyways. But before that, months before that, they were like, this is our plan of action. And so it was honestly, it was a relief, because especially I was having a rainbow, I didn't know. And here was all the stuff of like, let's make you feel better, but the best place for you is labor and delivery, just because they have everything. They're ready for you. They know what they're doing. This is what they deal with all the time. And just go in. Anything, just always just go in. Even if just like, I don't know, like, just go in.
And that's the care and trust that you need between providers. And like, obviously they're at that hospital, but they know that these people that are staff in the hospital see this day in and day out, and they're the best place for you to be. And that's always reassuring as well.
When it comes to asking questions, when we first started the VBAC group, I tended to go, I think, not overboard, but it tended to be my first approach was to ask for additional information. And then I backed off and I'm like, well, I would, say if your situation, if you've had this, or the other thing, then this is something you should look into. That way I didn't have to ask them, what exactly is your situation? They could either provide the information or not, as the case may be. Because information, I worked in a lab, and to me, like, information is king. I want all the information I can lay my hands on, but I'm not the provider. That's not my job. But it's good for people to know what their provider might be looking at. So they might go, oh, I didn't think that this was, something that was relevant, or this is something that they might be concerned about. Then they could sit there and go, okay, this makes sense to me, and, that kind of thing.
And I always appreciate your replies. You're very thorough. And even if it's not directly towards the poster who's saying it, and maybe it doesn't like, oh, no, that's not what's happening with me. Other people reading it are actually getting and reading these replies and be like, oh, yeah, that was what happened to me, or that's with me. So your replies are always thorough. They're not like a short and sweet type answer, unless it's like, go in now. And then that's when it's serious. Like, you listen to Ange. But your replies are always just they're well put together. They are to the point too. So I have to say, I appreciate your replies. So when I ever get a notification, I'm like, yep, she's on top of it. Like, we don't even have to go behind her. It's good.
Thank you.
Yes, and that's the other thing with the replies we do in VBAC too. They're not they're always kind of like towards the OP, the original poster, or people in the comments. They're also, we know so many people. I mean, this is a large group, and that is also why we correct the things we do, even if we know the member. It is, we need to catch these things because other people are following along. And there's a lot of people that don't want to speak up personally about their own birth or their own risk factors or what's going on. They're following and they're getting this information, even if they're not active. We know there are so many. We get posts. I've been a long time member. I haven't posted. This is my first post, and they just go on. It's just like, and they know a lot. Like they've been in the group a lot, and it's just like, it's surprising at times, just because, you know, you really kind of focus on the active members, not the focus, but you do get to know the active members. So then when somebody's like, I've been in this group from the start, and then they, you know, they're asking questions and stuff, and, you know, it's again reassuring that we're on the right track. And, you know, and there's things that sometimes we miss, or posts that we do allow up for, and we know that it's going to go sideways, and that's why we're like, we'll post it at this hour because we know more admins are going to be on. There are posts that we limit to, you know, the modmin team and then regular members, because we know there's going to be medical advice, and also sometimes shaming. I mean, like, I think we were talking about that sometimes in these groups, you get this mob mentality and you don't want to dogpile a member, especially when we know that we can reach this member. Now, if it's a doula or something, we'll allow those posts because those posts are always golden. Like, this is exactly why you have to, you know, research, and why we talk about doulas. We know there are a few good ones in the I guess in the whole bunch, but not always. And this is exactly why. So we can go back and we get to weed out like doulas too. Like, they'll pop up and want to defend their business and everything, and we don't. Yeah. So
Yeah.
there are fun posts.
I was
The
just
doulas
gonna
are
say
so
that-
weaselly.
yes,
They always ask themselves.
what you were just saying, Candace, about the people who have been there and you notice they've been there for 2 years sometimes or forever, and they finally do a post and they're asking questions, or those are the ones that is the power of the content for the lurkers. What we're always talking about is you just never know who's just reading along. So when people do accuse the group of dogpiling or of being too harsh, or why are you being, or even when it seems like, oh, this thread just derailed and no one probably got anything out of it. No, like, I think they're the perfect example of who we're trying to reach. It's perfect example. I see constantly, or people who are, you know, make those posts that say, I was feeling so horrible when I joined this group about pursuing a repeat C-section, and my heart was set on a VBAC, and then I felt so at peace now with my choice. Or even like, this group empowered me to make safe decisions around my TOLAC, and I had a successful VBAC. I love the ones that post the picture of their sandwich before the picture. It's like
Yes.
a big sandwich, and then there's like a baby somewhere in the corner. I love that. But I wanted to say, you always have to think of the people who aren't interacting, but who are reading along and getting things out of it. And that can be for good or for bad, depending on how the group is functioned, how it runs. And so,
Yeah, that's one of the things. The group culture matters a lot. And in the groups that are, what am I thinking about? Oh, the crunchy groups, shall we call them? The birth positive groups. There we go. The birth positive groups is the fact that if you see enough people get smacked down for suggesting you go to a doctor or, you know, pursue additional testing or anything, you are not going to be very willing to bring that up. You're going to be, you know, thinking, well, I don't need to talk about this here. This isn't important. It really does. I mean, the most important thing I think any group could do is to try to encourage as many points of view as possible, as many experiences as possible, which is why I'm really, really proud of the VBAC group being so diverse and reaching out to people from different backgrounds, because that's really important. Otherwise, you're going to end up with, unfortunately, the white cis women group, because they are the dominant culture in the moms groups, and they're going to be, well, disappointing at best and harmful at worst.
And we've seen that. I mean, we see it with a lot of those groups, and they forget that they are privileged, even though, you know, sometimes it's not recognized, or they don't even want to come out and notice that or say that that's what happens. And it's like you said, I mean, I'm glad for our VBAC group. And I've learned stuff and continue to learn stuff. We've all made mistakes online, and you continue to grow.